Hey, it's Dr. Jones here at Carolina's Chiropractic, and today I have Hannah with me, and she's going to share her awesome story with the use of the Vitabed here in the office. And so we're super glad to have her with us. And Hannah, what's the story?
The story is that I went in October for a routine colonoscopy. It was the first one I was going to have. Even though I was a little young to have it, they wanted to screen early for cancer because that's something that ran in my family history. So I went in October. I did not have any symptoms, which was good. And I had the procedure done. When I met with my doctor 2 months later to go over the results, he told me that I had early stages of Crohn's disease as well as chronic colitis. So I was very surprised to get this result and a little disappointed. I told him that, of course, I would like to avoid taking medicine if I can, any type of prescription. So he and I talked through different options, and since I was asymptomatic at the time, he was comfortable with me treating it holistically and finding a different approach. So at this point, it had been 2 months later. I told him that since the report had come out and the findings that I was aware of, that I had been doing red light therapy twice a week, and that I had incorporated a supplement as well for gut support.
When you say red light therapy, can you explain what that was?
I was specifically using the Suma's Vitabed at work, and so I was doing that mostly using the inflammation protocol and just trying to be really strict with doing it twice a week.
And how many sessions do you think you had between your first evaluation and the follow-up?
The first and the follow-up was about 30 sessions. Yeah, so I told my doctor that I would like to continue doing this therapy to see if it's really helping and if it's making a difference with the systemic inflammation. He, of course, had no idea what I was talking about. He had never heard of this before, and he kind of thought I was crazy, but he said, okay. He said, since you have no symptoms, I'm fine with that. Go ahead, do your thing, and we can revisit this in a few months. He said, you want to do a repeat exam? So I said, sure. So fast forward about 5 months, I had a second colonoscopy in June, and directly after the procedure, the gastroenterologist came in, and he was so surprised. Like, he looked at me and threw his hands up, and he just said, I don't know what to say. He said, there's nothing there. There's no inflammation, there's no Crohn's disease, there's no colitis. And I mean, we were all speechless, the nurses and everyone, because it was the same staff that was there with me. It was the exact same anesthesiologist and nurse and everybody. And they remembered, and they were just speechless. And he said, I don't know what you're doing. He said, but don't stop doing it. Whatever it is, don't stop. And he just left. It was amazing.
That's awesome. And so where are you now with a follow-up? When do you follow up with them just to make sure everything is, sustaining?
Yeah, I follow up with them in about a month.
Excellent.
Yeah.
How'd that do for you as far as hope and just...
It was such a relief. It was like, I just felt a huge weight lifted because I had been so nervous and so scared of the potential of chronic Crohn's disease and colitis and just what that could develop into later. So yeah, it was a huge relief for me. I felt very blessed to receive that.
It's awesome. And you said that you really didn't have symptoms prior to.
I didn't.
Do you ever suffer from any other musculoskeletal types of things?
I do. I have some occasional low back pain, and I do have some cervical pain that I'm dealing with right now.
And did you notice anything else when you were in that bed as far as symptomatic?
I did. Actually, about the last 2.5 years, I really suffered from sciatic pain. And ever since I started using the Vitabed twice a week, here we are 8 months later now, I've not had that pain once.
That's awesome.
So I even forget that it was something I dealt with at one time, but I did. Yeah.
So obviously systemic inflammation is substantially less.
Absolutely.
And we're not going to pretend. You do other things in your life that help with your overall health by eating right, exercising, all those types of things. You said you take some supplements, which is amazing. But as a full part of your overall health, you feel that this Vitabed has really done some great things for you.
Absolutely. I think incorporating it is the main reason I got the results that I did. Yeah, absolutely.
I really appreciate you sharing your story.
Absolutely. Thank you.